I know we had talked about this earlier, but just for the listeners and viewers, the managed care plan, these are third parties, these insurance companies outsource the hearing responsibilities to, correct?
Correct.
Okay. And in your experience, these managed care plans, are they only really in the Medicare Advantage sector, or is that the only?
Mostly they're in the Medicare Advantage sector. They're focusing on the senior population because the incidence of hearing loss is higher in the seniors.
Gotcha.
So that's their attraction.
So basically, you're looking at the insurance company, they're outsourcing, the need for hearing to this third-party company. They said, we've done our job. The third-party go ahead.
Yeah, so basically for many years, most of the major insurance companies, and it doesn't really matter who it is, they would have a benefit, okay, of $1,000, $1,500, $2,000. For instance, federal employees have a $1,250 benefit per ear, and they can go anywhere and they're entitled to their $1,250 per ear benefit. Well, most of the other insurance companies, the major carriers, had benefits. It may not be that, but it could be $1,000, $1,500. And these insurance companies realized that they're writing checks left and right to their subscribers, and they're losing money.
Yeah.
So they said, well, how can we just get that off of our plate? So then these managed care companies say, hey, we'll take it off of your plate because we can get better deals with the hearing aid manufacturers, and we can buy the hearing aids cheaper and blah, blah, blah. And you guys don't have to worry about anything. And on top of it, instead of paying us the $1,000 per ear, you're going to pay us $300 total for us to manage your subscribers.
That's interesting. And I know something we talked about is not only the management component, but you said a lot of these managed care partners are owners of hearing aid companies or partners. And so they're giving you a limited menu.
Correct.
And they're only working with their specific ones.
Right. So a lot of the major manufacturers have these managed care plans where they're actually managing the hearing aids because that's what their expertise is. And, so they're able to get the hearing aids, obviously, for a lot less money because they're actually producing the hearing aids. And for the most part, they may force you, or they may force the audiologist to have to order a hearing aid specifically from that manufacturer. And you're limited to what you can choose in some of these managed care plans.
So from your perspective, it's not only you might not be able to see the patient as much as you need to, you also could be limited in terms of what hearing aid they could actually get. So it could be a hearing aid that isn't best for them, plus there's no follow through in terms of the calibration or anything like that.
Yeah, well, when we fit someone with a hearing aid, we do our best to properly calibrate the hearing aid. But keep in mind, if it's a new user, they're only fit at 80% of their prescription, and there has to be follow-up care.
Thanks again for tuning in to Talking Retirement on YouTube. Please like and subscribe to keep up with the podcast, and check out all the other great educational content we have on the NJ Life and Health YouTube channel. If you'd like to listen to an audio version of the podcast, you can find us on Spotify, Apple Podcasts, and pretty much all other major podcasting platforms. For daily senior tips and to keep up with us at NJ Life and Health, follow us on all major social media platforms such as Instagram, Facebook, and TikTok at NJ Life and Health. And of course, if you'd like someone in your corner to help you with Medicare and life insurance, we would love to talk to you. Visit our website at www.njlifeandhealth.com or call our office in Toms River, New Jersey at 848-226-6897. We'd love to set you up with an appointment with one of our Medicare and life insurance brokers, and we are licensed in a lot of other states besides New Jersey. So no matter where you are, there's a chance we can help you out. Anyway, hope you enjoyed this podcast, and we will see you in the next episode.